Hey everybody, this is Dr. Langdon, board certified pediatrician, mom of 6, here today to talk about fluoride. You should know that fluoride is the single most effective public health measure to prevent tooth decay. You should know that there is no debate among medical or dental circles about using fluoride to help prevent tooth decay in all ages. Even now, when we can get fluoride in other products such as toothpaste or mouth rinses or dental varnish, it still has been demonstrated to reduce overall decay by 25%. That may not seem like a lot, but let me explain something to you. The amount of care that a parent needs to do for a child based on American Academy of Pediatric recommendations, which I endorse, are a lot. And I get that. You need to brush your children's teeth with a fluoride-containing toothpaste twice a day, 2 whole minutes. You need to see a dentist 2 times a year. You need to be on the lookout for needed decay and take them in for additional visits if you do note it or if they have tooth pain or anything like that. You must understand, people, that many families are not able to provide that level of care, or that many children are out there living in families who aren't taking good care of them. The children who end up in foster care have famously horrible tooth decay. It can cause pain. It can cause difficulty chewing and getting adequate nutrition. It can cause delays in expressive language. It can cause embarrassment and self-esteem concerns. And you guys, ironically, many of the rural counties which are discussing this very issue are the same counties who have a healthcare shortage for dentistry in their counties, particularly pediatric dentistry. And kids, most all kids are going to need a little extra help. Often some conscious sedation, or even for an extensive restoration, they may need general anesthesia. And particularly if they're special needs kids, there's just no way that the local dentist has the resources or ability to do that extensive restoration in a local office. Now, the same families who may not be able to afford dental care can struggle with transportation to out-of-county higher-level resources to access those. So you can see why removing the fluoride would be particularly a disservice to those kids who are already living in some concerning situations. The other thing I want to point out is that it's often been said, and in a misleading way, that studies show that fluoride is a neurotoxin. Folks, lots of things are dangerous if they are taken at a larger than recommended dose. We say in medicine that the dose makes the poison, or in toxicology that the dose makes the toxin. What that means is you could overconsume water. I know that sounds crazy, but you can. You can drink so much water that you lower your own sodium levels. It's called hyponatremia, and that can lead to seizures and eventually death. So anything can be overdone. The same with fluoride. Yes, at massive doses, fluoride could be dangerous. But the dose we use in the U.S. is 0.7 milligrams per liter, which is the same as 0.7 parts per million. And that is a tiny dose. We've been using it now for 75 years, and it's been proven safe and it's been proven effective. It was even more effective percentage-wise before we had all the fluoride-added dental care products that are available over the counter. Fluoride's really just incredible. It helps inhibit or stop the demineralization of that enamel that covers the surface of your tooth, and it helps promote the remineralization of that same enamel. So it's stopping decay and aiding in healing. That's incredible. Fluoride is incredible. Now, for those of you who say, then why does the package say not to swallow the pea-sized amount? Well, that's because if you have a slightly increased dose of fluoride, it can cause a cosmetic-only concern called fluorosis, or little white spots on the surface of the tooth. These are not dangerous in any way, certainly not related to a decrease in IQ or any of the crazy things that are going around on the internet these days. So I would just like to encourage you guys that fluoride is important. It's especially important for children, and it's particularly important for children who are in concerning situations. Also, I would love to add that many of these decisions need to be made by people who are trained, and public health is in the wheelhouse of their training, not made by people who are doing it merely out of political purposes. I hope that all made sense, and I'm happy to answer questions you guys may have. Thanks so much.